Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And today I am very excited to welcome back to the podcast Dr. Jill Crista. Dr. Crista is a fellow naturopathic doctor. She practices in the US of A, and she was one of my first guests actually on the podcast a couple of years ago now. We spoke a lot about mold illness and a bunch of other things related to that topic back then. And today we're primarily going to focus on PANS and PANDAS. If you're listening to this episode, you probably already know what PANS and or PANDAS is because it's a little bit of a niche topic, but an incredibly important topic. And we're really lucky to have Dr. Krista in our team, Team Pans Pandas, because she's just a wealth of information. She's been lecturing about this topic for many years. She's written a book on the topic. Oh my gosh, and I'm forgetting the name of it now. It's called A Light in the Dark for Pandas and Pans. And she also teaches clinician training courses specifically about pans and pandas. So that's the work of hers I'm familiar with. I have not read the book because I've done her in-depth clinician training course, so didn't remember the name off the top of my head. But anyways, that embarrassing omission aside, she's a wonderful resource, and I'm really happy to pick her brain about a lot of different aspects of pans and pandas. So I hope that this interview will be of interest to those of you who have children or if you're an adult who had pans or pandas once upon a time, maybe, or you're still having some symptoms, because unfortunately, some folks they get pans or pandas and say they're teens, and it's not resolved until they become adults, and so there's kind of this um, gray zone, if you will, of kind of like adult pans and pandas that doesn't fit the definition anymore because they're not pediatric and they kind of fall into a bit of a gray zone sometimes. So we'll be talking about that a little bit too, I think, anyways, depending on where our conversation goes. So I will pause the recording. I'll be joined again in just a moment with Dr. Krista. All right, everyone. Well, welcome back to the podcast. I'm now joined by Dr. Krista. Dr. Krista, thanks so much for joining me today.
Thanks for having me. I love our conversations.
I very much do as well. And thanks for being I was just mentioning you're the first guest I've had who's a second timer on the podcast. So thanks for putting up with me again in
I
advance.
love it. I feel like a returning champion or something.
I'll have to get you a sticker or a medal or something. I don't know.
Yeah.
Um, so just for folks who might not be familiar with your work already, although that being said, anytime I talk to patients nowadays about pans and pandas, they're like, "Oh yeah, like I've read Dr. Krista's book, or she's talked about on the Facebook groups I'm part of, or whatever." But if you wouldn't mind just giving folks a quick background in terms of who you are and what your how you became involved with the pans pandas world, please.
Yes. Well, I'm a fellow naturopathic doctor, as you are, and I am a mom of twins with PANS. And their PANS, and even calling it that is kind of inappropriate because theirs started with a congenital Lyme exposure from yours truly. I didn't know I had Lyme. I had, quote, fibromyalgia. Which really flared during my pregnancy. And it turns out that was just Lyme reactivating, and I shared it with my kids. And so they never really developed a normal immune system. So their version of PANS, which I think someday we'll have like a version that is a gradual onset. So theirs is more gradual onset until, it was full blown PANS. And even though they're identical twins, they're different in their expression. So it just is such a complex, the nervous system's such a complex thing. But that's how I got into it because I was just trying to help my kids. And then, lo and behold, the way the universe works, I end up in Wisconsin, which is Lyme country. So then I start treating Lyme patients. And then I'm sitting in a Lyme conference listening to Dr. Charles Ray Jones talking about congenital Lyme. And I'm like, he's describing my children. Whoa, we've got some homework to do. So, yeah. So it was really, I came by it by experience, but not even knowing that was the experience until I got the education.
Great.
Yeah. Hmm.
So did you um, were you were working on your own kids at first, and then did you how long after that did you start working with, like, were you already an ND at the time?
Yeah. Oh,
Okay.
yeah. Yep.
Okay.
I was already in practice and
Um,
yeah.
so
I
like
was one of the crazies that had kids during school. So,
I was one of those too, actually. So my second,
yeah,
yeah, it's one of the first.
they have their own time schedule and
They
I
do.
apparently agreed to it.
Gotta wonder about those soul contracts, once in a while. It's
Uh,
like, what were we thinking? But anyways,
right.
so once you learned about like once you started working with your own kids, did you start working with patients pretty much right away, or was it a little while before you were seeing pans and pandas in your own practice?
I was working with them. I just didn't know that's what they had. So, I was working with a lot of kids who had food allergies, heavy metal toxicity, chemical sensitivity, pesticide reactivity. The kids that fall through the cracks, they have, their diagnosis, allergy or behavioral disorder, all of these things. So these kids tend to be pretty sensitive kids. And the antecedent state, so the thing that starts all of this is an immune depletion. So a normal infection whacks the kid harder than, it turns it into an autoimmune disorder instead of just fight the infection, move on. So a lot of those kids are kids who you become immune depleted, either like in our case, handing Lyme to my kids in utero, or they're just sensitive or they're bad detoxifiers. And our toxic world is really tough on our kids.
Mm-hmm.
Yeah. So I was already working with, what I kind of got known as the one that could figure complicated kids out. And and then I got more training. I was like, oh, I'm getting better at this because I'm getting more training and education about this thing. So yeah. Yep. I actually had a not a resident, but we have preceptorships in school where you go and you shadow.
Mm-hmm.
And one of my favorite preceptors, who we ended up hiring him when he graduated, he brought me this article and he's like, I wonder if this is this condition, with this patient we were working on, he was sitting in on. And it just kind of was like, oh, I've got to go get every continuing ed I can get on this thing. So spend a lot of time on the East Coast. Yeah.
Um, so kind of looking at your practice now as it relates to pans and pandas, compared to say your first few years of working with kids with those labels, what would you say is significantly different now compared to back then?
I think things are more toxic. COVID really messed that up. More toxic, more inflamed. And yeah, I think that I'm finding it a lot faster. But again, I think there's more education out there. This is 2004. So, it's a lot easier to find solutions on your own as someone who's struggling or a parent of a kid who's struggling. Where before you would just go to your doctor and whatever they knew, you were limited by their knowledge, just like all of us. We don't know everything. There's no way.
Hmm.
But if you go and then maybe you go shop around and go see another doctor for another opinion, you're limited by that doctor's knowledge and training and their openness to learn new things as well. Nowadays, you can get onto Instagram or, Facebook or the internet or YouTube and be like, what is going on with my kid that just developed ticks?
Hmm.
What's a treatment for ticks? Might be the search that would go into the search bar. And somewhere in there, pandas may come up now. I mean, even in my own little tiny town, last week there was a little article from the UW-Madison Medical School. It was a little excerpt that said that OCD may be pandas, and so go, rule that out if your kid develops OCD. And I was like, wow.
Wow.
Well, 20 years later, here we are.
Hmm.
And even then, it was like, it's very simple to treat. Just give antibiotics,
Hmm.
move on.
Oh man, you just got the
I had a
memo that it's
couple,
easy to treat, eh?
right? I had some parents send me this and they were like, I'm steaming mad. And I was like, wait, we have to see the progress here. It was in the paper,
Hmm.
you know,
Hmm.
that's pretty good.
Yep.
The tricky thing is OCD in a kid can look very different than OCD in an adult.
Hmm.
We may not recognize it as OCD. So, the constant checking for reassurance, that can be OCD in a kid.
Hmm.
And all you would think is, wow, this kid's either kind of dense and not hearing my answer. Well, it's not that they're not hearing your answer, it's that they have OCD.
Hmm.
Or they're fear-based, they're just a really nervous kid, those kinds of things. So it's not necessarily repeat hand washing, although that can happen.
Hmm.
Yeah.
Um, any other like little tells besides just them asking for reassurance, like other ways that it would kind of more specifically appear in kids versus adults with OCD
Oh,
behavior?
sure. Yeah. So I actually write about this in my book because I want to have parents start to understand that the compulsion, which is the behavior, is led by an obsession, which is a thought, which is induced by the body saying something's wrong in this area. So if it is to like do your nose and sniff, well, there's probably sinus colonization here. So we need to be looking at the sinuses, do some diagnostics, see what's going on in the nose, treat that. A lot of times humming will be done to sterilize an area that's infected because when we hum, the surface area of our tissues gets a little nitric oxide, and that makes it basically a sterile zone. So if you hear vocal tics, like hmm, hmm, those kind of things, like that could be a compulsion, which is a behavior from the thought, I have something stuck in my throat or I'm, whatever, which is the body saying, hey, create a sterile zone. So if we really pay attention to those compulsions, we can often really nail down where the child needs specific support.
Hmm. Very cool.
Yeah.
Okay.
Yeah. I
Um,
had one kid who the compulsion was, if I don't look left the entire time on the way to school, we'll get in a car accident. And what does this say to you? Like I'm stuck in this position. It's like he was trying to open up a lymphatic channel.
mm,
And so we sent him for craniosacral and that compulsion went away.
wow.
He literally didn't have enough flow.
Hmm.
And it had nothing to do with the car or the bad thing. It was that his brain was literally not able to drain and detoxify.
Mhm.
And so he'd keep his head locked in one
Right.
spot.
Wow.
Yeah.
Very cool.
So we can really, bodies are so wise, you know,
Yep.
we
Just
just
have to
listen.
pay attention. Yeah, exactly.
Yeah. Right.
So a couple of quick things. One is you mentioned your book, A Light in the Dark for Pandas and Pans. And where can folks access that book?
Anywhere you get books. So Barnes and Noble, Amazon. In Canada, it's I think it's Indie Books that you can get it in Canada.
Okay.
Yeah, anywhere you get books and off my website. Yeah.
Perfect. Okay, great. And then I just wanted to mention, as per usual, nothing that we say on this podcast should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. I just wanted to circle back to something you said earlier, and just, for a discerning listener who might be thinking like, wait, Dr. Crista is saying like, a depleted immune system can predispose to pandas or pans, but like, isn't this an autoimmune issue? And like the immune system's
Mm.
kind of freaking out. So would you be able to address that maybe on a superficial level, what seems like a bit of a paradox, like how would a depleted immune system lead to autoimmunity, but how does that happen yeah, please expand on that.
Ah, thank you. Thank you for this question because it is so important in understanding the body. You will hear in a lot of, especially conventional medicine understanding, autoimmunity means the immune system is overactive and out of control. And when we really look at what is going on, when you look at the actual T cells, we look at the actual numbers of natural killer cells, so the actual numbers of our immune cells and how they're behaving, and the kinds of inflammatory molecules that they're spitting out, it is more of a sign of immune depletion and dysregulation than overactive. So there used to be, when I was in school, they'd say, you can never give echinacea to someone with autoimmunity because it'll make the autoimmunity go worse. It'll make the body attack itself more. And what we find is actually the other way around. When we support the immune system, it starts to get organized. And I think of it as all of us, there's times where you get so busy and you're just, especially with younger kids, you're just running, 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 running. The laundry doesn't necessarily get done. The mail doesn't always get open to hit the deadline of the thing. And, things can just get scattered. And then you can get so busy sometimes and overwhelmed. Let's say you get a sick parent, then on top of that, then it's like you lose the discernment of what's the most important thing to do next. And sometimes you'll find yourself, I should be paying that bill, but I'm folding laundry instead because that's what's visually I can handle right now or whatever. That's exactly with the immune system. It gets so depleted, it loses discernment of what is really important. And it also loses discernment of self and non-self. And so it can just react with a non-specific reaction that can harm self tissue as well as the invader.
Great.
Yeah, that's a great question. I think, a big big part of this specific autoimmune system, disease, whatever, is the lack of the microbiome in the gut. There's a strong connection between the types of species in our gut and our brain health, and actually types of species in our lungs. There's a lot of research showing that if the microbiome is dysregulated in our lungs to promote types of species that have more endotoxin, which is a really inflammatory molecule for our body, that predisposes people to a higher risk of developing an autoimmune problem in the brain.
Hmm.
So our biomes really matter. And that's, we have a lot more understanding now that if you have a dysbiosis or dysregulation in your biomes, I'm hoping people will start paying more attention to the lungs because that's where mold comes in. That is an immune depletion because our immunity is dictated from the critters living in our gut.
I was going to ask this question later, but I'm going to ask it now because it directly ties into what you just said. And I don't know if this was a direct quote from your PANS Pandas training course, which any clinicians listening, it's awesome and can't recommend it highly enough. What I have from my notes here is rat studies have shown that gut-derived endotoxin can lead to the loss of dopaminergic neurons and microglial migration in the basal ganglia in a dose-dependent manner. And so just wondering if you could, you already kind of touched on this a little bit, but maybe just riff on that a little bit in terms of like how that really ties into how important gut health is in these kids.
Yeah, I think you said it there. And a lot of people, if you're not a doctor, you're going, what did you just say? But the gut-derived endotoxin means from the microbiome, the bacteria in your gut. There are some bacteria that are good for us and some that are what we would call non-commensal or more pathogenic species. Those are the guys that when you have too much growth of them, they'll kind of beat out the commensal ones in population. Not that the others are gone, they're just not in the amounts that we want to sustain health. Our gut microbiome largely dictates our immunity, our brain chemistry, obviously our weight. I mean, there's interesting mouse studies where they give skinny mice microbiome fecal transplant from fat mice, and they become fat mice, and vice versa can happen. So, a lot is determined by those critters in our gut. The ones that are more pathogenic or non-commensal, they tend to express more endotoxin. And this has to do with the cell surface of the bacteria. And these endotoxins also are called lipopolysaccharides. So it just means a lipid with a sugar, but they're made in a form that is very inflammatory. And even if they don't get into the bloodstream, which if you have a leaky gut, you're going to get more into the bloodstream. Even if they don't have access to the bloodstream, if they're just sitting there in the inside of your intestines, there's a message that goes up to the immune cells in your brain called microglia, which I call the monkeys. Those immune cells are in charge of cleaning up debris, making sure that there's no infection in your brain, and it's just out there. That's why I call them monkeys. They're just they have these little arms and appendages, and they're just swinging around looking for stuff to clean up. And prune, they help with like pruning the nervous system. Our brain works on a use it or lose it policy. So if we're not using a pathway, it'll start to trim down and support the one you are. That's how you get muscle memory when you're in the gym and those kinds of things. So those little microglia, they have a direct text line to the microbiome in our gut. So the bacteria in our gut and the immune cells in our brain are constantly texting back and forth, like, what's up? What's up? How are you doing? Are you having a good day? And if the gut has more endotoxin, those guys get upset and then they flare the ones in the brain. And when those get flared, even if there's one monkey that gets mad, it will start spitting out cytokines to attract other monkeys. And so you can get this entourage effect of inflammation. And then the mast cells say, what's going on over there? And so then mast cells will actually migrate and rush to the area to take care of it, which those are, I call them cluster bombs because one mast cell has all these granules that if it degranulates a certain kind of bomb, that bomb can set off multiple bombs as well. So it just is this, again, this cascading effect where you can start with one little spark of inflammation and then pretty soon you have a wildfire. That's all from the gut. Yeah.
So, for folks listening, like that's probably the most succinct way that you can take a really complex topic and describe it. So that's why
Thank
it's
you.
nice to have a rewind button to listen to that again if that didn't, if this is your first rodeo or you're new to this topic. But for folks listening right now who aren't going to take the time to rewind because they're folding the laundry or not instead of paying bills or something like that right now,
Right.
um, would you be able to just say like, okay, so like sounds like, if stuff in the gut's not going well, it can cause a lot of bad stuff in the brain, and that relates to these kids. So like what would the kind of the practical advice from that would be like what can we do for the gut and what can we do for the brain to kind of help, keep the monkeys happy and prevent that, like negative text messaging happening in the first place?
Yeah, the big one would be to eat organic food. And we have a condition in PANS that can have a lot of food restriction for many reasons. Um, so we don't want to get really food restrictive. But really, a simple thing would be no more weed killer in your kid's gut. It's the number one bad guy. It's even worse than mold, actually, when we look at the microbiome studies. The microbiome can chew up some of the mold mycotoxins if we have a good amount of the right species. But glyphosate and atrazine are extremely toxic, and atrazine specifically can cause dopamine receptor loss and destruction on its own with no infection. Yeah. So it's a very simple thing. People say, oh, come on, does that really matter? It matters. It matters a ton. Yeah.
I remember learning many years ago that when they discovered glyphosate, they were trying to figure out what to do with it. And they're like, oh, it's an antibiotic, but it didn't pass the litmus test to become a antibiotic as we think of it because it was really only good at killing the good bacteria in the gut and it was really crummy at killing the bad guys. Um,
Right.
so let's just put it in the food supply and see what happens. And yeah, so just another, chalk up another win for humanity making a great decision, or at least big business making a good decision for humanity. Um,
Right.
okay.
Right. And they'll say in their defense, they'll say, well, we tested the pathway that it stops, and human cells don't have that.
Mm,
And they're right. But we are more microbe than man. There are more gut bugs, DNA to DNA, cell to cell, than in our own body. So we are really actually planets hosting these other things.
yes,
Whatever happens to them happens to us.
yeah.
Hmm.
Say nothing of all the tens of thousands of mitochondria in every cell that are all bacterially derived from once upon a time in evolution. So, and what impact is that having? And man, oh man, can
Yeah.
be on the rabbit hole. Um,
When I set up my practice back in early 2000s, I put a patient on a probiotic, and that was the first angry phone call I got from conventional medicine. I got a gastroenterologist called me and told me how dangerous I was, that I should be put out of practice because I'm giving my patients bacterial infections.
oh,
And I thought, wow, I got a good education because I knew, and now, everybody's talking about the microbiome now, and because it is so important, and we got that training in school.
mhm. Yep,
Mm.
yep.
Yeah.
Well, yep. Shout out to naturopathic colleges everywhere. It's very,
Yes.
very good. Um, so um, I have a bunch of questions for you, Dr. Krista. So they're not in any particular order. I kind of skipped to the end of my list with that last one, but just kind of pivoting away from the microbiome, the multiple microbiomes. I was wondering if you have found that cognitive behavioral therapy or EMDR, which is eye movement desensitization and reprocessing, or any other psychological interventions in particular are helpful in PANS and PANDAS patients.
I've seen CBT backfire big time.
Mm,
I think it's really good for parents.
okay. They need help.
Yeah, right. Because the essence of CBT is that we're trying to help you work through your false beliefs and false thoughts. And in my experience, these kids, it's nothing false about it.
Mm,
Their brain is actually being attacked.
mm,
So I think it's very different because this is a physical destruction of the nerves, of the neurons in the brain and the basal ganglia, and the interneurons, the ones that connect them. So these cholinergic interneurons get destroyed. There's something very real going on in that brain, very physical, very tangible. very mechanical, and there's nothing wrong with those kids thinking.
Mm,
They're displaying, and like I said, if we listen to the compulsion, we listen to the behavior, we can learn a lot about what's going on with the kid and where they need support. I had one child that wanted to put his poop in a pillowcase and sleep with it because he could not handle the idea of flushing it away. And I was like, that kid needs a microbiome. He's literally telling us, I can't afford to excrete this because I'm running so low on species that I need.
mhm,
We got him on like very high dose colostrum for a very short time, which is in my regulate immunity core. Got him some probiotics, some fermented foods, got him off all the weed killer in their diet. That problem completely went away.
mm,
So I mean, again, there's nothing wrong with their thinking, even if that seems like a pretty extreme behavior,
mm,
saving poop in your pillowcase, that's pretty gross.
mhm,
But he was saying exactly what was going on. He was telling us through his behavior, and cognitive behavioral therapy would not have fixed that problem.
mm,
Not that I'm against it. I just think we need to be very careful. I think modified is good. I've seen a very strict CBT also put one of my patients in the hospital with dehydration because they wouldn't let him drink water. He'd say, I'm thirsty, I'm thirsty, I'm thirsty. And they were trying to work him out of that behavior because it was making him have to, they thought it was making him have to pee a lot. So then he couldn't go to school because he was embarrassed about having to go to the bathroom all the time. Well, it was the other way around. He had mold mycotoxin exposure. The body in its wisdom was like, we've got a toxin in our blood. We need to flush more. So it wasn't that he was drinking water and making him pee. He was peeing too much and needed water. By the end of the 8-hour training, he had to go to the hospital for hydration. So I think we need to be really careful
mm,
in not listening to these kids and giving them what they need. I keep reminding parents, like, oh, could we just get them back to school, get them back to school? I'm like, their immune system is working so hard right now. It's just like they're fighting pneumonia. So would you ask a kid with pneumonia to jump back in?
mm,
I don't think so.
mhm,
So we do need to give them time to convalesce, time to recover. And I know the pressure of that. Let me tell you, I'm a single mama. It's complicated when you have a kid who can't go to school. How do you go to work? How do you get your stuff done? There were many, many times where my son was sleeping on my office floor so that he could just hang, and go to the bathroom when he needed to and all of those things. So, I come at this, I think, from also just being in the trenches with a lot more, I want to say softer, but also curious. I think we need to stay curious and not just jump to like, we're freaked out about this behavior and fix it quick, fix it, that kind of thing.
mm.
Because then you could put them on a steroid if they didn't really need a steroid. And if they have a chronic infection, we've just blossomed that infection.
Right.
I don't know if I answered your question, but
You,
yeah.
you definitely did. Although a
Okay.
follow-up to that is, what about EMDR?
Oh yeah, EMDR is lovely. I've seen that really help. Just get the wiring to get back into the brain. It can flare a kid who's actively having those neurons get destroyed though, because it does rely on a lot of the cholinergic system.
Mm,
So if we can use these plants that we know that help assist the cholinergic system, once we get, if there is an infection load, get that going and taken care of, at least supported, and then get their nervous system supported with the acetylcholine, that tends to go better.
mm.
Hmm.
Um, and then I guess kind of a bit of a follow-up there too. Like say, um, as best I can tell, anyways, with some of my patients, there seems to be this, like, let's say they're at the point where maybe they're like 80% better, 75, 80% better. Like they're, lots of improvements. Still not quite 100%, but sometimes I find there's a bit of this almost like a gray zone at the end where there's certain patterns or behaviors where you start to wonder like how much of this is still related to neuroinflammation that or immune system activation that hasn't yet been reconciled yet, and how much of it might be a trauma response from everything the kid's gone through, or how much of this might be, related to like a bit of a learned behavior in some cases. And I mean, not throwing any kids under the bus with what I'm about to say, but like just, kids are kids, and especially like smart kids where it's like, it's like, oh, like, I am there, there could be in some cases like maybe a little bit of, aftermath, like attention seeking, or they're getting more like dad never really hung out with me, but now dad's with me all the time. It's like, like not to say that they're malingering, but just where like there might be like a little bit of, there could be psychological layers, let's say, that maybe it's not just all, that maybe in those residual cases, like not everything's just rooted in the neuroinflammation. So I guess my question would be like, are there cases where you've kind of seemingly hit a bit of a plateau and it was more like that, say mental emotional work that was the, um, missing piece of the puzzle, like for some of those cases where it's like, we kind of hit all the bases on like, more on a physiological level, and it seemed to be something a little bit more related to like more of a psychological intervention or something like EMDR that was helpful at the end, or is that not something that you've really seen much in practice?
I haven't seen it all that much, but if we are there and we're thinking that homeopathy can be very helpful.
Hmm.
It's very, very helpful. And then really talking with the parents because it's usually not the kids that are afraid to move on. It's the traumatized parents that never want to have that fall off the rails again. And so they almost don't allow the kid to grow.
Hmm.
So I think that and that's natural, but you do also have to be like, okay, now you don't have to do that part for them anymore. Then you get to the place where it's like, how many things now can you allow them to do on their own and have some oopses and some, like had sugar and things flared a little bit or whatever, like not to be so overly controlling because they're trying to do what they can do that's really good for the kid, but you can definitely become like the person who is now preventing expansion. And once the immune system does get healed up, now it needs to be challenged just like a bicep, like now we need to allow, it's not always infection and not every infection becomes a, a total travesty and a total flare. Not every diet slip up becomes a total flare. It's just we have to know where that threshold is. So
Hmm.
usually it's kids are pretty ready to go, move on.
Good. Okay.
Yeah.
Yeah. Haven't seen it many times where it's been that gray zone, but thank you for sharing that because yeah, just curious. You've seen a lot more cases than me over the years, so just thank you for sharing.
Yeah. Sure.
So also just wondering too, like I really appreciate you, kind of really trying to figure out like what do these symptoms mean for kids. It's like whether they're humming or wiping their nose or wanting to keep their feces in their pillowcase or whatever, just
Yeah.
stuff like that. I'm just wondering what has been your insight with some uh, patients who have had like just pretty severe food restrictions. Um, what are some of the insights that you've had around like why they might be restricting food so much?
If they have a profound amount of neuroinflammation, our swallowing mechanism is pretty complex. Actually, it uses four different nerves to swallow. So if it is that they're saying, I can't eat because I'm going to choke, listen to that. Because we wouldn't tell a post-stroke patient, oh, just get over it. We modify how we provide the food.
Yep.
So if they are afraid of choking, that means their swallowing mechanism doesn't feel right to them. So you need to be looking at all the resources of how do you modify food for a stroke patient and do that for the kid. So gelling liquids, grinding food, all of those things, because that fear is real. And they're just in touch with it. They can tell. If it is that they don't want to eat because they're afraid of germs and contamination of the food, or, they didn't like the look of the person who was making the food, or mom, you breathed on it when you were making it, or whatever, dad breathed on it as he handed it to me, whatever the germ thing, then we know they need antimicrobial support more vigorously than what we're providing it at the time. And it could be that the foods that we get into a pattern in families of eating certain foods. It may be that the food that we're giving them is high in histamine, or maybe it's high in salicylates or oxalates. So getting into, which I have lists for all of that, getting into kind of like are there certain foods that they are, quote, picky about or refusing, and certain foods are okay? What's the pattern in that? Is there anything that we can find that is telling us, like in the case of salicylates or sulfur sensitivity or histamine, a lot of times those kids are fungally infected. And when we get them on antifungals, those things go away. Oxalates, very commonly fungally infected. So there might be something about the food itself. And if that's the case, then, get curious. So I think just really understanding like, is it body dysmorphia or is it something a little different, and staying curious and not getting too nervous. Because then I feel like when everything goes, they're not eating, then there can be food issues generated that weren't even there because everybody's now like being, watching the kid out of the corner of your eye while they eat. Like, did they eat? Did they swallow it? Did they spit it out? This kind of thing. Because of course, you don't want to watch a kid melt away.
Yeah.
But there are some plants that we know will reduce the neuroinflammation and will tell the body to not satiate so quickly. 'Cause
Mhm.
that's another part of the basal ganglia is where we control all of that, the diet appetite centers in the brain. So if that's being attacked, you can eat a little bit of food and then you're dealing with the bulking reflex in the stomach that says, "Oh, we got food, we're good, you can stop eating." So if it's a kid who starts and takes a few bites and then stops, that could be gastroparesis from Lyme. Lyme also does that in the brain, or from, some of the mold effects, some of the PANDAS effects. And there are plants like gotu-kola, rosemary, feverfew that all help with reducing that agitation from the presence of food. And then the last one would be the dysbiosis part we talked about already. If they have more pathogenic species in their gut, then when they eat, they're feeding those guys and they're going to get a surge of endotoxin. And so the body will say, stop, so those are two potentials for a kid having a few bites to eat and then not wanting any more food. Could be gastroparesis and it could be endotoxin. And again, plenty of plants and things. Gotu-kola is really lovely because it crosses the blood-brain barrier between 5 and 15 minutes. So I often will have a kid take a little bit of gotu-kola tea about 10 minutes before it's eat time. And then we can usually sneak past that endotoxin surge. So many tools,
So many tools.
so many tools. I just want everyone, if you're dealing with this as a practitioner or as a parent or as an adult who got it when they were a teenager or maybe in your early 20s, there are adults with this condition. It's not called PANDAS or PANS because that's a pediatric. It should be called ANDAS and ANS for the adults. But yeah, if you're listening, like, please know that there are so many tools that you have. And if one thing that you're doing isn't working, keep going and keep at it.
It's a good pep talk. And yeah,
Yeah.
I mentioned in the intro that we'd talk at least a little bit about the adults that like, fall between the cracks. But yeah, so maybe we'll bring them up a little bit more. Or actually, well, maybe just on that note, like, are
Yeah.
there, I feel like, I mean, to my knowledge, the mechanism of action is the same. It's like, oh, like I had this at 17 and now I turned 18. Like it's like, oh yeah, suddenly everything's all different. It's like, are there
Right.
distinct are there any distinct differences though in terms of how you would address like say this and like say a someone in their early 20s who's been like, maybe misdiagnosed or just struggling to get better for several years since they contracted this in teenagerhood versus how you would treat a say a 15-year-old or something like that? Like, are there any distinct differences or
No
it's all
difference.
the same? Okay.
No, same. Yeah. Same treatment. I mean,
Okay.
it's the same mechanism.
Mm,
So yeah.
okay. Well, that was fast. There we go.
Yeah. That
That
was
was
easy.
easy. Yeah. So one question I have, I've been uh, investigating the and working with the Neural Zoomer Plus panel from Vibrant Wellness. This is not a CME certified podcast interview, so we could talk
Yeah.
about
Yeah.
anything we want. I'm just wondering where there's some overlap there with, to my understanding, with the Cunningham panel. I'm just wondering like how those two, how you do you use either of them in practice? Do you prefer one over the other? Would you mind riffing on that a little bit, please?
Yeah. I love both of them. I think they're very useful tests. The one that I find very helpful for determining how aggressive do we need to go on the immune part is the Vibrant one because they have the blood-brain barrier leakiness aspect.
Yes.
And I find that really beneficial because when I see that, I know this is a kid who absolutely needs to be eating organic food, no weed killers, because the glyphosate and the atrazine cause the leaky gut. So that's a big part, that's not something we can kind of mess around with for a while. And it tells me they have a leaky gut because they have a leaky brain, because those two go in hand in hand.
Right.
So then we're focusing on more things like butyrate and maybe some peptides and, just things that are really focusing on healing up that gut.
Mhm.
But a tricky thing is most of the time when you hear that, people will say glutamine. You need to eat a lot of glutamine, take glutamine as a supplement, and because it heals the gut.
Mm.
And it does, but in a pandas and pans kid who already is swimming in way too much glutamate in their brain, that glutamine can actually cause a flare. So we use things like butyrate instead and let the body choose if it wants to make more glutamine.
Mhm.
Kind of practitioner level stuff there.
Good, good reminder for all of us.
Yes.
Um, any pro tips in terms of how to get kids who can't swallow pills to take butyrate since it tastes like a dog's breakfast?
Dog's breakfast. Yeah. And rotten eggs, stinky socks, farts. I've heard all the, yeah.
Food.
Ranch dressing.
Right, right. I remember that from your course. Yep, yep,
Yep.
yep.
That's our sneak.
That's
Yeah.
the thing. Okay. Um, let's see. And
That's straight out of Wisconsin right there.
good stuff. It's your claim to fame there. Um,
That's
I was wondering if you either you yourself or refer kids with PANS and PANDAS for screening for primitive reflex retention, or if that's something that, yeah, primitive reflex is something that's important to have those integrated, or do you look into that at all?
I haven't. Usually on a neuro exam, I don't know that I see a lot of disturbance in those. So no, that's not like a big, can you educate me? Have you been monitoring this and seeing a trend?
Um, Honestly, not really, but I've been thinking about
Okay.
it because
Yeah,
I've been picking up primitive reflex retention issues or yeah, either primitive reflex retention or kind of like redevelopment in like some kids like on the autism spectrum, kids with ADHD, just kids that are kind of like non-specifically neurodivergent and maybe having some challenges like related to that neurodivergence, like they kind of yeah, not pathologizing neurodivergence in any way, shape, or form, but just sometimes, of course, there's some challenges that folks run into
right,
related to that.
right. Well,
Um,
and like our colleague, Dr. Taylor Bean says, autism isn't a diagnosis.
that's a good way of
And
putting
what she means by that is don't stop. That's describing a syndrome, but that's not necessarily, that doesn't say anything about cause. And if it is something causal that's ongoing, we need to address it,
it.
you know?
Yeah.
So I just love that when she says that. And of course, everybody gets mad when she says that.
There's
But I
not a
think
phrase that
you're
goes
onto
both ways.
something because Dr. Larry, oh my gosh, he's gonna get mad at me. Larry Pavlovsky. Sorry, Larry.
Very
He gave a great talk at MAPS this year on the normal neurological tests before we normed to pathological norms. So if you look at the PEDS books, even from 60 years ago, the developmental landmarks that we had set
Hmm.
are now not being met by the majority of the population.
Right, right.
So I think the name of the talk was like developmental landmarks before we lowered the bar.
Hmm.
And like some of these things need to be caught at that young time because that's where it can set up a stage for like a pandas or pans or an autism or things like that.
Right.
And so I think it is good we need to retrain all pediatricians on the old texts because we have normed, just like with our blood labs, anything you're ordering through your standard labs has been normed to the population.
Hmm.
But look at our population. We are not healthy people. So we're norming everything. We're lowering the bar little by little by little.
Mhm.
So I love to look at labs in a functional way, and I usually do a pretty complex neuro exam. Um, but yeah, it's like I'm thinking like a Babinski and things. I don't usually see those be altered in a pandas pans kid.
Yeah,
But if you are, I'm curious if that's
yeah.
happening.
The Babinski, I find it like never comes up, like for me, when I do these primitive reflex screens. But yeah, I can send you some resources if you want. Maybe
Sure.
But I'm sure you probably do a lot of telemedicine though as well, so a little
Well,
challenging.
now I'm doing only consultations with other
Okay. Right.
practitioners.
Okay.
So
Yeah.
yeah, so that's I don't even have like I can't even go and try that on people.
I'll
Do
let you
it
know
through
if I
their
figure.
practitioner, but
I'll let you know if
yeah.
I figure things out. Yeah. It's yeah. Anyways, I'll leave it there for now, but I'll let you know if I
Yeah.
figure anything out
I
that way.
will say with IVIG, we have seen meningitis with the IVIG just because it activates the immune system. And so I mean, there are some kids that they get so much swelling at the base of their brain, and they need steroids before IVIG. So that's a whole other like technical thing. But yeah, in those cases, they cannot, even tuck the chin, let alone lay on a table and do it.
Right. Yes. Yeah.
Yeah.
Um, all right. So I was also kind of in a quasi similar vein. I'm just wondering, do you ever or well, historically or nowadays when you're consulting role, do you think is there any role for myofunctional therapy in kids with PANS or PANDAS?
I think so. Yeah. Again, though, I think first and foremost, we got to get the attack on the brain done. Over, no more.
Mhm.
Reduce inflammation, modulate the immune system, s prevention, stop whatever was coming into the body from doing that. If it was a toxin-based thing or a strep carrier in the family who keeps infecting. So those are my big priorities. And then, depending on how long the kid has had it, a lot of that stuff can normalize on its own. But anything that can help. Like craniosacral, I think has been the most powerful,
Mm.
especially after dental work, because they do, that keeping the mouth open in that way and the head kinks up the basal ganglia. And so we need to do craniosacral right after every dental work so that we can get the lymphatics working again. I'd say that's been the most powerful thing. Yeah.
Then you've touched on choline a couple of times, including mentioning the cholinergic interneurons. Just wondering how useful are phospholipids as supplements in this patient
Huge,
population?
huge. Yeah. A lot of times these people, and I'd be curious in your practice, kids with PANS and PANDAS, but more so PANS. I think in my practice, it's over 90%, even before, I was the mold queen. 80 and 90% are mold related. They have either had mold in their house or their mom was pregnant with them, was in mold when she was pregnant. I mean, mold is in that picture somewhere.
Mm.
And so phosphatidylcholine is huge for this. Keeps the cell membranes fluid, just helps with that oil change, helps with detoxification, nourishes the nervous system. It's just if our membranes aren't healthy, how can our body be healthy? Our poor little mitochondria.
There are membranes everywhere. I'm telling you, just can't get away from us.
Membranes.
Um, have you found that there are certain brands of phospholipids that seem to be more beneficial than others?
I haven't seen this thing of like the acetylcholine is better than the phosphatidylcholine or that I haven't necessarily seen that to be the case. I'm like, whatever will be taken by the
Mm.
kid
Hmm.
is the right brand and the right way.
Okay, good.
Yeah. But I'm curious because I just had a conversation with a colleague about that. They're like, acetylcholine is really moving the needle for us. And I'm like, what are you noticing? That's so different because it didn't seem to matter for my patient population.
Great.
We're all different.
Were you primarily using liquid
Mhm.
phosphatidylcholine preparations?
Phospholipids
Yeah.
together.
Hmm.
Yeah. The empirical labs, they make a nice phospholipid sunflower base.
Okay,
So you're getting the serine and the choline and
great.
mhm,
Okay,
yeah, that calming of the serine.
lovely.
A little
Uh,
calm is yeah.
you kind of alluded to this, I think, but have you specifically seen COVID as being a trigger for PANS? And
Yes.
okay.
Yes, 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 and all the yeses. Yeah. Big time. So mast cells express ACE2 receptors with they really highly express them. And so if, you're getting ACE2 tweaked, you're getting more mast cell spillage. And then if you have mad monkeys in your brain and you have more mast cell recruitment, if you have fungal exposure, you have more mast cell recruitment. Now you throw in a spike protein that triggers those ACE2 receptors and you get more spillage. And yeah, it's been, there was a Yale study showing that people 709 days, that's when they ended the study, past their exposure, whether it's, vaccinated or got COVID, still had spike protein in their body.
It's crazy.
And you probably have all my nicotine stuff on why that is. So
Yeah. I,
there's, yeah, there's other proteins involved that we need to be addressing. Hmm.
took me a little while to wrap my head around that one. And then even now, when I talk to patients about nicotine patches, they're like, Dr. Raid, like, you've told me a lot of crazy things over the years, but like, I never thought I'd hear you say get a nicotine patch. So I was like, yeah, Dr. Krista says it's good. And then obviously predicated on some publications. So
Right, right,
pretty,
right, right.
pretty
Mhm.
cool. Uh,
Amazing.
so are there if say PANS does seem to be COVID induced or COVID triggered, I should say, um, are there things that you would do differently treatment wise versus, other causes of PANS?
I mean, treating the cause. Just like if it were Lyme Borrelia or Mycoplasma pneumonia or the flu. I mean, influenza can really flare a kid. It's the cause of many flares, but also the cause of the initial flare in some kids. So if it's COVID, we need to treat COVID. And that involves things like nicotine to get the spike protein dislodged, things like digestive enzymes, and things to protect the blood vessels in the brain and in the whole body, like vitamin E and vitamin C. So yeah, I would just treat it like a virus plus, because
Mhm,
it's a virus plus a toxin,
mhm,
peptide toxin. So we need to treat it. I use antivirals and I use all that other stuff to help get rid of the toxic part of it.
mhm.
Yeah.
And as
I mean,
far
I've had kids have like, and people say, are you using that on children? Like, well, the other option that you were about to do is put them on a steroid that's going to cause bone loss. So maybe we could try this other thing that, or on a biologic or, rituximab. I mean, we're going to get rid of all their B cells, or we could try this nicotine patch and see how that goes. And not that I'm against the medicines if you need it. I mean,
sure.
my kids did, 30 IVIGs, I think, to get them rehabbed. So I'm not against intervention. I want everyone to understand that. That's why I'm also not against this intervention. I treat it as a medicine. I don't treat it as a, recreational whatever. You need to do pre-treatment because it is a medication with side effects and manage those side effects and use it responsibly. Yeah.
So you're pre-treating before nicotine?
Yes.
Okay. In what
Yes.
way?
Vitamin E and C to
Oh,
protect the
okay.
glycocalyx. Yeah, because we find that once you dislodge the spike protein from that nicotinic receptor, now it's loose and it does more harm loose than it did bound.
Gotcha.
So we have to be ready for that. So
Okay.
those enzymes, those at the minimum. And then I have a whole series of videos on vulneraries, which is an old-timey term for enhancing cell turnover.
Mm,
Because people have to understand that if you have a virally infected cell, the way we get rid of that cell is to kill the cell. And so then what?
mhm,
Another cell has to come up and take its place.
mm,
So you can only kill as fast as you can replace.
mm,
And vulneraries are really important. My favorites that were also studied for COVID-19 and had antiviral activity is plantain or plantain, red clover, and cleavers.
mm,
Each of them kind of have their own, special thing. Like cleavers is really good for lymph movement. Red clover is a good anticoagulant. So if there's a lot of coagulation as part of the picture, people get a lot of mottling in their skin or their, purple fingernails and that kind of thing.
mm,
So yeah, we just pick the herb that helps out. A lot of times when I was doing acute COVID, I had patients just mix all three. They can buy in bulk, very cheap. And then just put a cup of each one in like 4 quarts of water, boiling water. Let that steep, strain it off, and it can go in your fridge and you sip on it for the next 3 or 4 days.
mm.
It's very easy.
Sounds very nice. And
I know. You can add honey if you like sweet stuff or mint if you like mint,
mhm,
make it tasty.
lovely.
Yeah.
Um,
Hmm.
as far as the enzymes you're using, is that primarily nattokinase or are you using any other proteolytic enzymes?
Natto was in the studies, but natto has been fermented. So since I treat a lot of mold sick patients don't do as well with fermented
Mhm,
things. So I use lumbrokinase
mhm.
typically.
Okay.
That's non-fermented. Yeah.
Great. Okay.
That's a nice strong one. Very reliable.
Great.
Mhm.
Um, and by any chance, do you have any thoughts or experience with the augmented NAC that people are talking about a bit these days with respect to spike proteins?
I don't. I know it's all the rage. Yeah.
A lot of people talking
I
about
mean,
it.
my exit strategy for my patients off nicotine is NAC, and I don't know that I notice a difference between regular old NAC and augmented. I think that part of the problem with regular NAC is once you open a bottle, it starts to oxidize
Hmm.
and that and lose its potency.
Mhm.
So I think also just like good supplement bottle management, like don't try and buy smaller bottles and try to only open, like you can put things in their fridge and just things like that to make your supplement last longer.
Right. Okay.
Yeah.
Okey-doke.
But NAC for pandas and pans can be dopaminergic. So I'm really cautious and careful who I do that with
Mhm.
if it's pandas and pans.
Okay. All right. Well, Dr. Krista, I know our time is kind of winding down. So, were there any outstanding things that you wanted to mention? We've covered quite a bit of ground, but any like last you had a couple of nice pep talks in there as well. So I
Good.
feel very satisfied. But is there anything else you wanted to mention before we wrap things up today?
I don't think so. I think just a reminder to parents to you deserve support just because, behavior started and your world might have gotten smaller because people get worried, or maybe you're worried your kid's going to get judged. A smaller world doesn't mean it's not the same as no support. You can have a smaller world and protect your kid and still have buco support for you. So if you have that belief, work on uncoupling that belief.
Thanks, Dr. Krista, as always. So already mentioned the name of your book. Once again, A Light in the Dark for Pandas and Pans. And if let's see here. So if folks want to tap into your brain, they have to work with a clinician who consults with you. Is there do you have a database, or is there how do folks is there some way that folks can
Oh
find out who
yeah,
works with you?
that's a good question. Not really. Not
That's
on
okay.
this subject specifically.
That's okay.
Yeah, because it's usually mold pans, So if you're working with a mold literate doc and yeah. And I'm doing monthly master classes for the public. We're just dialing down on very specific conditions or parts of this whole thing.
Mhm.
In October for Pandas Awareness Month, we're going to do homeopathic treatments for pandas and pans to get
Mhm.
out of acute.
Okay.
Yeah,
And is that on your website, I'm assuming?
it will be once I
Okay.
get that
Okay.
up. Yeah. I'm
Right.
doing monthly ones. We've done salicylates, oxalates, actinomycetes. We're doing binders next week. I'm doing antifungals next month. So I'm just like, what do I get a lot of questions about? I'll do a master class on it. And you
Cool.
can join. They're live and interactive. And then it'll be recorded if you missed it. You can catch it later.
Cool.
Yeah.
And I know you're quite active on Instagram. And are there other social media platforms that you spend much time on, or mostly
YouTube.
the
I have a YouTube channel that's where some of the longer form stuff
oh,
goes.
yes, of course, yep, including your famous nasal spray video that patients tell me
Yeah.
about all the time, all the time. Um, awesome. Okay. So I'll in the show notes, I'll put the link to your website, Instagram, YouTube, any other online offerings that I should put on there, or is that's
Oh, I can't think of anything. Yeah. I'm just busy now more than anything formulating for a light to make sure that we have clean, clean supplements and things that are targeted so that we can get people better faster. I'm really impatient. So
um, the supplement line? Because and sorry, have not been on your website in a little while. So it's a supplement line that's yours, or it's a company you're affiliated
I'm
with?
part, yeah, I'm the formulator and medical director. I'm part of it.
Oh,
Yeah. And it's called Alight Health Formulas. And we have formulas for pandas and pans
okay,
um, that are specific to reducing the neuroinflammation that is specific to pandas and pans.
great. And is that through your website as well, or is that a separate website?
You can get some through mine, but Alight Health Formulas is the website.
Like
Yeah.
ALIGHT?
Yep.
Okay,
A light. Yep.
Cool. Awesome.
Yeah.
All right.
Yeah. And they're pretty easy to find because they're named with a panda word. So there's bright panda, chill panda. So they're all herbal glycerates. There's no alcohol, so they're safe for children. Adults can take them too. But
Cool.
yeah.
Okay.
Yeah.
Well, thank you
Been
so
busy.
much. Oh, sorry. What's that?
I've been busy.
Yeah, yeah, you don't seem to ever rest. So yeah, you're an inspiration, Dr. Krista. And thank you so much for taking the time to chat with me again today. It's always a pleasure. And yeah, wish you all the best.
Thank you. Thanks for having me back.
It's my pleasure. And yeah, thank you to everyone who listened to this episode of the Overcoming Chronic Illness podcast. We hope you enjoyed it, and please stay tuned for the next one.